once I got pregnant, I really wanted to gather as much information as I could about what I could do to make the whole process as good as it could be for me and the baby. So it was nice to know that I had trustworthy information and was accountable for the day-to-day decisions I made about activity and nutrition.
And so it really aims to help pregnant women to increase their physical activity behaviours, their nutritional behaviours, and also to try and control their gestational weight gain during their pregnancy. And we do that by providing tailored feedback. We also help the clinicians to prescribe appropriate recommendations, again as a part of that routine care process.
I think this is an important initiative of CQUni, and I think it has to be encouraged, and I'd like to congratulate the university on really taking a practical focus on local communities of Central Queensland. These programs deliver practical benefits for our communities and practical benefits for my patients, which lead to both improved health outcomes for my patients and therefore improved benefits for community with reduced access to hospitals, reduced need for people to seek secondary care and improve their health.
I really enjoyed the Fit4Two program. It was really nice that the feedback was quite immediate and it felt quite personal. You know, I would put how active I had been that week and what I've eaten, and immediately it would give me feedback and suggestions for how to improve in the week ahead. And it was nice too that my doctor was involved, so I could show the doctor the progress I was making and get the feedback from both the doctor and the program. So it really helped me be more accountable.
Because if we have healthy mothers, we also have healthy babies. So when we talk about healthy mothers, we really want to try and reduce those pregnancy-related complications such as preeclampsia, gestational weight gain, hypertension, and all of those contraindications or those adverse health outcomes are associated with pregnant women when they're inactive or they gain too much weight and they're not making healthy nutritional choices.
The Emerald Medical Group developed a partnership with CQUni around a really innovative research project called Fit4Two. And the reason we were interested, well, there was many reasons, but the key one was hearing about the possibility of improving the health and well-being of women during their pregnancy, because we know how important it is that women are well, they have a healthy diet and they maintain a healthy weight through pregnancy, because it means better outcomes for their children and for themselves during childbirth. One of the great opportunities we have with CQUniversity is developing partnerships on the ground with practicing clinicians to really address, I guess, just day-to-day issues that we know have been neglected but can lead to great outcomes both for women, in this case with the Fit4Two program, but for the broader community as well. When we bring it back to local community, what we can do is we can actually address important issues that affect people's day-to-day lives.
So we've seen throughout our program and throughout a number of our studies that physical activity is increasing among our participants, and also that our women are making healthier nutritional changes. Because we know that women who are active during pregnancy are more likely to be active after pregnancy, and children born to active mothers are more likely to lead active lifestyles themselves. And children who lead active lifestyles are far less likely to suffer from childhood, adulthood obesity. They're less likely to have as many hospital visits in a lifetime. And then it's that whole cycle, whereas if we have a healthy child, we can really help to change and influence the behaviours of the next generation.
I definitely would recommend the program for other pregnant women because it helps you feel like you have a grasp on how to live best for you and your baby, and it makes you accountable to yourself and to the doctor to talk about how nutrition and physical activity can impact your life and the baby that's growing inside of you.
What happens in the first 1,000 days of life predicts a person's health outcomes for the rest of their life, and if we can improve that first 1,000 days, which includes the antenatal period, we can improve the lives of children. So I think the feedback's been incredibly positive. The women are enjoying the ability to be engaged and be a part of the process. And again, this is quite an innovative thing for us to be doing for them.
So we need to tap into those GPs so that we can engage them in part of that holistic healthcare approach.
So this was a fantastic opportunity for Emerald Medical Group to partner with CQU to really do some practical on-the-ground research that will demonstrate some really effective outcomes for pregnant women. It's very innovative, and it's important that universities are in touch with their communities and understand what the issues are in their communities and develop practical solutions that lead to practical and good outcomes.